Ready, Gemma?
Oh.
All right. Well, welcome back, everybody. My name is Briggs Hanewich. I'm a board member with ECVO. I'm super happy to be here today to moderate this panel discussion with three really great people. I think virtual meetings make for, frankly, I'd love to see you all in person and be with you. And I'm sure the rest of you, we'd like to see the energy in the room. But virtual meetings allow us to pull in people from across the province and across the country. So we have a really awesome panel today to discuss an equitable recovery for the sector. So today we have Gemma Dunn, as you all know, Gemma with ECVO. We also have Alexa Briggs, the Director of Policy and Research with the Calgary Chamber of Voluntary Organizations, our equivalent organization out of Calgary, and we work really closely together. And then we also have Abdul Nakua. I hope I said your last name right.
Correct.
Abdul.
Yeah.
The Director of Institutions with the Muslim Association of Canada. And Abdul, you're also were with Imagine Canada at one point in the recent past, correct?
Not as employee, but we worked with the collective table.
Right.
Some of their programs.
Great.
So working closely with them, but not part of their staff.
Yeah. So
I told them,
sorry, go ahead.
I told them I'm extended staff to Imagine Canada when they need help.
Perfect.
During COVID. So
that's great. So we really have a both a provincial-wide scope, an Edmonton-focused scope, and a national scope today to talk about an equitable recovery from COVID-19. And as you saw in the materials that went out for this and the marketing, I'm sure this isn't news to any of you. The COVID-19 pandemic laid bare deep systemic inequities faced by many communities that we all support and work with, including women, members of racialized communities, those with disabilities, and individuals struggling with mental health and addictions. And today we want to talk about both, what those inequities look like and what are we going to do to address those as a sector. And so the first question to our panel, and I'm going to pick, I want this to be a group discussion, so please feel free to question each other or talk with each other about this. But I'm going to actually start with Gemma. And the first question I want to ask is, when we talk about inequities, what inequities are we talking about? What have we seen or that's been exacerbated or changed due to COVID, Gemma?
Yes, I think that you have already spoken to a couple of them there, Brooks, but we have seen huge inequities in our communities of colour. Women have really gotten the short straw as we think about sort of the new responsibilities that women have, and they have been 1.8 times more likely to lose their job because of COVID. And if we're looking sort of through an Edmonton lens, we've seen inequities in access to arts, sports, heritage. So we've started to see inequities in terms of how people can engage in things that are wholesome as a community, and also those organisations struggling. So we're seeing sort of a duality of inequities, those that are affecting people who are most closely impacted by the issue, those in poverty, those in those communities, but also our organisations aren't all deemed the same as well. So a lot of the organisations who are deemed to be almost like the fluff of our communities, like sports and heritage, have not had the same access to grants and resources federally and provincially. And also what we've seen as well with our organisations, those in the social sector, is that they are dealing with the greater complexity of issue and decreased capacity, because many of the people who work for those organisations are women and people who are also having to homeschool, look after elderly relatives. So I think that's what I would talk about, but I'd be really interested in hearing from Alexa in terms of sort of the work that CCVO is doing and sort of how they're thinking that piece will really sort of target some of these inequities as well.
Yeah, Alexa, does that resonate with you? Is there anything else that you're seeing?
Yeah, I made a lot of notes on this one. So I might not work all of that in, but I'll highlight a few things. I'll add some provincial context maybe to the bits about the impacts on women. So we do know that that women were far more likely to lose their employment. There is evidence now that women have regained some of those losses in terms of labor force participation. However, hours worked still may be lower than what they were pre-pandemic for women. And then in particular, parents of young children have been disproportionately affected, regardless of gender. So there is something to pay attention to there, I believe, in terms of recovery. Because of the challenges with childcare and schools, and the sort of back and forth of closures and so forth, there's impact there. And then the other thing that I would note provincially, particularly in terms of labor force participation, is that women were already a bit behind in Alberta. So this is pre-pandemic. Our labor force participation is just over 80%, which is below the Canadian average, which is 85%. And it's much lower than Quebec's labor force participation, which is closer to 90%. So, so there's regaining the ground we've lost, but then also how do we catch up nationally? And women also have one of the greatest wage gaps provincially in the country as well. The other thing I would note would be domestic violence and the increased rates that we've seen. Complex factors, but largely due to isolation. And so, that obviously disproportionately affects women. And so, for example, domestic violence related calls to Edmonton police rose 16% in 2020. And then Gemma touched on this, and I just want to give one quick example in terms of the caregiving impact. So, obviously that disproportionately falls to women as well. And then just to highlight a very particular example, there's been recent research into long-term healthcare aids in Alberta, and it's really brought some of those disparities to light, particularly with an intersectional lens. So women make up 89% of that workforce, 80% are immigrant women, and 77% are racialized women of that 89%. So it's a huge impact on racialized women. And so one of the issues in Alberta's pandemic management was a single site policy. This may be different now because long-term care regulations have shifted, but at the time, so staff in long-term care or designated supportive living facilities were required to work at only one facility for the duration of the pandemic. And so overwhelmingly, these women were working at more than one work site prior to this policy, right? And that was simply out of necessity to make ends meet. And so some of these women are now earning upwards of 70% less than they were pre-pandemic due to that policy. So there's huge impacts, particularly on the caregiving industries, and then and other industries that are primarily female employees. So if we think about education, for example, also primarily female-dominated sector, the nonprofit sector has had huge impacts. We're 75% women in Alberta in the nonprofit sector, and healthcare workers. So for example, in Alberta, 94% of nurses are women. And these are industries where that are facing considerable burnout and also exposure and illness. So I'll leave it there on the women front. And then there are other, definitely others, issues of inequity that we may want to talk about a little later.
Sure. Abdul, is there anything else that you would add to that, potentially from like a national perspective?
Yeah, let me just say how happy and excited I am to join you. Alberta does have a special place in my heart. We do have 2 chapters in Alberta, both Calgary and Edmonton, and so I come often to the province. And I have fond memories of the province and its people. So I'm really happy to join you from Ontario. As Gemma said, I think the biggest thing that I think those issues were there, but what the COVID exposed is just the complexity of them. and how regionalized, on how demographically, how they are affect more people than others, and just the complexity of really dealing with them and finding solutions that are not, they are neither easy nor inexpensive. And so poverty and homelessness and mental health and social isolation, those are very complex societal challenges that just the pandemic just exposed the extent of them and how they can be harmful to society. And I think that's what the shock of all of us came, is just how those inequalities and inequities can really impact society in ways maybe policymakers never imagined they would be. And I think that would be the shock, the shock that everybody has, and how everybody want to address them in one way or another, in some equitable way. But I don't think it's easy, nor anybody has a solution to all of those. They are expensive, they are multi-layered. We need all hands on deck as a society to address them. And so it's important that our sector has its input as a sector and as a lens, because we bring with us certain values that I think are critical to address all these inequalities. And so fairness, compassion, mission-driven, those are values we really espouse, and we run our organizations as such. And I thought to bring them to the public square in more clearer way would be one of the contributions we can make, so that ideas and policies that governments will be enacting will be informed by communities' perspective that we may be most able to bring to the discussion table than any other sector.
Right. So I'm just going to pause for half a second, and I didn't do my job as a moderator. If you have questions, please put them in the chat and we will answer them probably at the end. Like we'll pay attention to the chat. If there's something that comes up that we're like, oh, that's really relevant, we'll jump in. But we can also leave and come back to those in the end. And Lisa, you'll be looking at the chat and kind of following that as well. So apologies for that. So Abdul, I do want to jump into, I know when we chatted and we were kind of talking about the panel earlier, we were talking about what barriers we were seeing from a nonprofit sector perspective that are limiting our response. And particularly, as you just mentioned, with government, I think Gemma also said, we're seeing kind of a duality between the struggles of individuals and communities and families, and then also the sector more broadly. So what barriers are we seeing from that nonprofit perspective?
Yeah. So I think it's twofold. One, I think, is intrinsic, internal to us as a sector. And it was clear when we tried to work with Imagine Canada and getting the sector voice to the government, and we tried to put the collective, and we tried to put a brochure so that we can share when we meet with elected officials and senators, and it took us quite a bit of time and energy to really drive a concise half-pager of what the sector is. So we as a sector really don't share a unified voice of who we are or what value we add to society or to the country or to a specific policy. So that voice, I think, is missing in terms of it's there, but it's siloed and fragmented because of the diversity of the sector. And the shared narrative is missing. Like we don't speak really in a way that's. I'm sure we met with enough politicians. I mean, the attention span there is not more than a few minutes. So if you don't have a narrative you can say in 5 sentences, you lost them, and they're not gonna. They're looking for the next person coming to see them. So that shared narrative, I think, is very, very critical. The sector itself has a very broad, it's very diverse vertically and very diverse horizontally. So vertically, in size of organizations, Some are huge organizations with so much money, and that money is grant money or foundations. The bulk is at the bottom with very few resources and trying to make ends meet. So that variation is very important in terms of how they see themselves and how their narrative is. And then in the horizontal, we cover so many subsectors, from the environment to the old age to the social services to religious and faith groups. So those are by nature are very different, and so uniting them into one narrative is not an easy job. And so I think Imagine Canada and some other provincial networks trying to bring that coherence to the message and to the sector. I think they did well, good enough in this pandemic, but I think still a lot of work for the sector to really be seen as a sector with a specific ask, with a specific mission. And those values we spoke about are clear, articulated in stories and in narratives.
Alexa
The
and
second,
Gemma, oh, sorry. I just want to
the second, just quickly.
Yeah,
the second is the other coin. The other side of the coin is governments really. It was very clear to us. Really don't understand the sector. They see us in a very small prism, that service delivery piece, and they see us fit as a service delivery agency for some of their programs. And it was very difficult to get across that, or to articulate, especially with the waste subsidy and the rent subsidies. It was very difficult to get them to understand the diversity and the special situations of the sector. And so they came back when they did the program, and they were asking for feedback because the uptake wasn't what they expected. And we told them, yeah, because it doesn't, maybe the way you set up the program, the sector was an add-on, and maybe 70% of us would not qualify or would not even know how to navigate. And so that misunderstanding of the sector and its richness is another impediment for a new relationship, and will require a lot of work from the sector to really lead the government into seeing the sector as a partner rather than a stakeholder.
I wonder, Alexa and Gemma, and maybe we'll go with Alexa first, like, does that resonate with you, the idea of a lack of a common voice or a shared narrative, and the diversity of vertical and horizontal? And then, obviously a result of that is the government sees us as service delivery and not much else potentially. So I'm wondering if that resonates with you, and do you see any other barriers in, that limits our response?
Yes. So yes to what Abdul said, and I would just add to that. This is just probably different words for the same kind of idea that he was speaking of, is that the nonprofit sector does not have a home in the provincial government. So we don't have one specific point of contact, which means that we're often trying to navigate multiple ministries separately, and they all have their own ways of operating and communicating. And so British Columbia, for example, recently appointed a parliamentary secretary for community development and nonprofits. So that's what that does, is it just creates a really important indication that the province is prioritizing the sector, and it's giving organizations a means to navigate government bureaucracy. And so because to Abdul's point, we're just not always recognized for the contributions we make. And there's actually a pretty good example of the top-up funds that were given to frontline workers. I think that was through it was a federal government program. And so the nonprofit sector seemed like a bit of an afterthought in that process, and the eligibility was really unclear. And then we did hear, and Gemma might know more about this particular issue, but we did hear reports that frontline workers in the nonprofit sector were not deemed eligible, even though they were doing it's exactly the same job as their counterparts in the private sector and public sector, were eligible for that top-up pay. So sometimes, and it's not deliberate or malice on the government's part, it's just kind of an oversight, and where sometimes the sector is a bit of an afterthought. The other piece to that, I think, is that we don't have comprehensive data on the nonprofit sector. So we can get quite a lot of data about charities, so nonprofits that are registered charities, but the sector as whole, not nonprofits that don't have charitable status, we have very little data about them. So we really need to understand what is that subsector breakdown, the regional breakdown of the subsector of nonprofits. What are those organizational, what are their sizes, their operating budgets, the staff complement, and the total number of volunteers, and regionally, so that we can look at that and compare across the province. And then the other point, two other points. I'll make them quickly, and then if anybody's got questions, we can dig into this deeper. But I don't want to just recite a bunch of statistics at people, which might be a lot. I don't know.
No, it's good. We'll get into the stories. This is good. Let's get the stats out early.
So there's the sector itself has been hard hit. So as organizations, right? So while we're attempting to continue operating and delivering services, our organizations are also suffering. And so this is from a report that we did a few months after the pandemic. Some of these are from a survey that CCBO did, and some are from a survey that the Alberta Nonprofit Network did. And this was just a few months after. So we can imagine that it's probably, things have gotten possibly worse. 85% of Alberta nonprofits had a decrease in revenue from fundraising. 78% had a drop in earned income. 90% were affected by working remotely. 80% experienced staff absences because of childcare issues. And again, some of those have likely gone up, and that was already pretty high to start with. And then others anticipated having to do staff layoffs and so forth. And then the other major impact, which Abdul touched on as well, is the mental health impact that's had on employees in nonprofits. And so, the realities of the COVID-19 pandemic have meant that employees are increasingly stressed for economic reasons, anxiety, social isolation, additional responsibilities like childcare, increase in workload, and a loss of job security. Also experiencing layoffs, so seeing your colleagues lose their employment is difficult. Shifting to remote work was a big leap for many of us, and then also experiencing loss due to COVID-19. So people who have had loved ones pass away from or become really quite ill from COVID-19. All of that really just takes a toll on people. So yeah, and then I'll make it really quick. I promise this is the last point, which is that in terms of our ability to respond, we haven't been made a priority in the provincial recovery plan or in the most recent provincial budget. So really, without going into too much detail, the recovery plan that it was originally released last June from the province focused quite heavily on capital investment, so like physical infrastructure, roads and buildings, and it did not have a real community recovery plan embedded within that. So there was really no focus on the nonprofit sector and the role that we might play, or how people are going to play a part in that recovery process. And then the last point I'll make is about being absent from the budget a little bit in terms of as a priority. So if we look, for example, at the Ministry of Culture, Multiculturalism and Status of Women, that has many programs that support nonprofit organizations in Alberta. And so the ministry's been experiencing budget cuts since 2019. So that was the first budget we saw from this government, from the UCP government. They're expected to receive 230 million for 2021. And that's a total of about a $20 million cut. And then as we see their projected numbers, we continue to see a decrease in the budgeting for that particular ministry.
Right. And just to promise everyone, we're going to get to opportunities. We're going to get to, like, this isn't all doom and gloom, I promise. Gemma, I just want to give you an opportunity to respond to some of those pieces and maybe give some context for, the work maybe more locally here.
Yeah, I think like everything that Abdul and Alexa said, I completely agree with. I think that one of the things I did want to mention, dig into a little bit more that Alexa spoke about, is this idea that we moved online, but we didn't do technological transformation, right? Because we don't have that kind of money, we don't have those kind of resources, we don't have that capacity. And so like the nonprofit sector is constantly trying to shift and adapt and pivot, but we don't have the kind of resources that are afforded to other industries to really understand what a successful transition to the technological space looks like. And again, that would be the same for earned income and sort of donations and stuff like that, that diversification of funding models. Many nonprofits have shifted their focus to thinking about social enterprises, but really don't have the skills and the abilities internally to really understand the kind of effort and time that takes to be successful in those spaces and the kind of upfront funds that you need to put in first. So we have sort of like this disparity between sort of like what is expected of us by governments and private sector and what we're actually able to do.
Mm-hmm.
I think that from an Edmonton focus, we're at a crossroads here in Edmonton because we're just about to go to our municipal election in October, and we will have a new mayor. And the mayor that we've had sort of providing leadership over the last 8 years has been very, he has had a huge social agenda. He has, he sponsored the End Poverty initiative. He is very much entrenched in the sort of the social issues that affect Edmontonians. And we don't know who our next mayor will be, and we don't know who our next council will be. And so it behoves us to really understand sort of who's running for council and what that means, and how do we start building those relationships. And we've heard a lot here, so like this talk of sector, and we need to speak with one voice. And I think that Abdul really said it well, as well as Alexa, that we're not really a sector. So we're called a sector, but we don't have shared values. We don't have sort of like this shared sort of direction in which we're going. We don't have a unified voice in which we speak to government, and that shows in our advocacy efforts that they're often siloed. And we don't have one sort of space in Alberta really, or locally in Edmonton, who is doing research on behalf of the sector and really sort of driving some of those policy issues. And again, like within the municipal government, we don't have one space for the nonprofit sector. Like we're spread across depending on the issue that you're working on. And so it becomes really difficult to get those policy objectives really solidified within the government. And I think that one of the things that when we're talking about mental health, and mental health I think is going to be a huge issue. It is a huge issue, and it's going to become even more of a huge issue as we sort of come out of this lockdown, is that one of my colleagues was talking to me about the fact that what the pandemic has done is it's created a space where we start to realize that what was before was unacceptable. And his example was sort of, when was it ever acceptable to have 250 homeless people in the Bissell Centre because it was cold, and the staff having to deal with 250 people in one space? When was it ever acceptable to have an open camp on a piece of land that because there was nowhere else for homeless people to go in our city? So I think that what we've started to see, that some of the unacceptable practices that we have had before sort of been able to justify through the lens of sort of the capitalist structures on which we are governed, is that people no longer want to work in these spaces. They no longer think that it's acceptable to be asked to work in these spaces, and they also don't think it's acceptable to treat humans in the ways that we've been treating them, just because they don't sort of tick all the boxes of our current society.
Right. There's just a comment. I'm reading through the comments as we go here, and based on what Alexa said, do we even have a consistent definition of nonprofit and what includes, e.g., or i.e., religious organizations, parent councils, etc. Right. So even that. But I do want to transition now based on what Gemma said, where this idea that, you know, we're able to, I think, more articulate what is unacceptable and where the breaks are in our society and some of those things, right? Like it just became much more clear. So let's talk about opportunities. Let's pivot now. Obviously, there's a whole host of challenges here that we've put up, and I think there is value in the clarity of the challenges in some ways, right? And being able to see those things much more clearly and maybe have them at the forefront. So I'll start with Alexa for this question, if you don't mind, and then we'll kind of move around, just trying to give you guys an equal start here. So what are the opportunities? So what opportunities are you seeing potentially at different levels of government? Are certain areas more conducive to a response from the sector? Like, given everything we just talked about, what are the opportunities and what should we be thinking about over the next year, 3 years, 5 years? What does this look like?
I'll highlight one particular piece of work at the provincial level, just because it's timely and what we're working on at the moment. And it relates to the gap that I identified earlier, where the nonprofit sector community has not been a centered part of what we're identifying in terms of our recovery from the provincial government. And we haven't seen it also then reflected in the money in the budget. And so where we see an opportunity there is to say, well, what if we did? What if we made community a central part of recovery and focused it in terms of that being an important part of how we plan our economic recovery in the province. And so prior to the last provincial budget, CCVO did make a submission to the provincial government with a request for a $350 million investment into a social infrastructure fund. We obviously weren't successful, but we're going to keep trying. And so just a little bit about social infrastructure. Social infrastructure are assets to society that support the quality of life of a nation, region, city, or neighborhood. These assets would include programs and services, amenities, relationships, and structures that go beyond economic functions to make a community an appealing place to live. They support us to create a more resilient, just, equitable, and sustainable society. So we see that as a really important addition to the recovery plan as it stands right now, which, as I said, focus on capital investment, which often those jobs are male-dominated fields. And so what we know is that social infrastructure investment, like the one we're proposing, would create 4,500 jobs, which is nearly 3 times more than the kind of capital projects in the province's plan. And it's more likely to be jobs for women and racialized people. So that's really an opportunity we're focused on is this request. We think it's probably a big swing, but we're going to keep advocating and working for that. And then we'll be probably asking for support. The other places that I think are opportunity, particularly for the province, would be around childcare. So the federal government has announced in their budget their intention to create an early learning and childcare plan across the country that requires willing partners at the provincial level. And so we would hope that our provincial government will participate willingly. They'll need probably pressure from groups like ours to do that. And then I would say also addressing the wage gap that also exists within the nonprofit sector. So even though we are a sector dominated by women, we still earn less than our male counterparts by about $4 an hour. Same with visible minorities who work in the sector. It's about $3 less an hour than non-visible minorities. And those are huge. We can address that. we could fix that in the sector, and it would go a long way towards us walking the talk that we give, but also being more effective as organizations.
Gemma, what's your response there? And obviously, as like kind of equivalent organizations in Edmonton and Calgary, where are you seeing the opportunities, and are they similar? Are there other spaces that you're seeing opening up?
I'd firstly like to start by saying that ECVO is supportive of the work that CCVO is doing in every way. And so we try to find opportunities to amplify their work and to support their work as required, because this big hit that Alexa talks about would have like a significant impact on the sector as a whole. And so as an organisation based in Edmonton, we really are very supportive of this work. And we will continue to be so. I think that, you know, I agree completely about the childcare, and we would be looking probably through the ABNN to look at how do we apply pressure to the government in this space to think about winning partnerships. But I think there are a couple of other opportunities that we need to think about. One of the opportunities that we're exploring is around mental health and a benefit scheme for the sector, a scheme that would be customized, because, you know, we see customized schemes all over the place, because particular types of workers need particular kinds of benefits, and within our sector we're sort of left trying to find what fits best, what we can afford. Many small organizations can't afford anything. We have the EFP programs that employees aren't taking up because they're not significant enough. And yet when we look to our government counterparts, they have robust benefit plans. And so I think there's an opportunity for government to work with the sector to provide equity in healthcare for our workers. And we will continue to go down that route, especially with sort of the highlight of mental health issues across our workers. And the other opportunity I think we have, and Alexa spoke to this earlier, I think, but is that the sector often thinks of us as sort of like a delivery arm of government, and we're not really at the table. And we really need to create tables where we have equal voice, and the government coming to our tables as well, because we have so many amazing collaboratives, especially here in Edmonton, that I can speak to, where we're inviting our government counterparts to be part of our tables, and then take the elements that we're working on up to the government. And we've seen some real success in sort of having that kind of a mechanism rather than everything being top down. I think it helps, like locally, municipally, it works a little bit better than provincially. However, there's huge opportunities there for the provincial government to really see us as partners. And one of the other things that is like really top of mind for me is philanthropy, and how philanthropy is really flawed. And the government is pushing us to earn more money, and that they want to see sort of less reliance on government. But we're working with the sector, so in terms of the business sector, I think there's a huge opportunity there to change the narrative around what they can do for us, to how do we work together for strong communities, and stop having people who are suffering and most vulnerable being sort of put front and center as sort of their causes. I think that it's broken, it's flawed. Like, we have mega rich companies who want to see their names on the side of buildings, rather than, like, can we really think about philanthropy as something that is building strong communities and strong connections, and we're partners working together in terms of like that three-legged stool, rather than the non-profit sector being seen as the poor cousin who is just sort of full of do-gooders who want to like fix the world's problems. I think there's a huge opportunity there for us to think about that.
Yeah, and it sounds like both a shift in kind of the overall narrative of what the sector, where the sector kind of fits in people's minds and government's minds and our own minds, frankly, and then a shift in kind of the power dynamics of how we work with government and other institutions and other groups. Abdul, is there anything like, does that resonate with you at a federal level?
Yeah, and I think there were great points. I'm gonna tie two of them together and build from the federal and where we see things going. But there were two key points. One is really a value our sector brings that no other sector does, which is what Alexa said, the community. And it was interesting that our sector were the first. We noticed the impact in the pandemic before the government did, because we work in communities. So we saw the impact in our communities, and that's an advantage our sector has that really no other sector nor the government really has that pulse in the community. And that ties to the second important point that Gemma said, which is we want to sit at the table. We don't want to be a service delivery arm of the government, nor we want to see programs that we apply to for funding, but we want to be really bringing our values and discussions and ideas to be part of the discussion. And that's where I see hope in this post-pandemic space that the pandemic really created for us. So there was a report done by two senators, Catalyst for Change, regarding, I guess, not modernizing the sector, but improving the condition of the sector. That was before COVID. There were many recommendations, many consultations. The promising thing is that the government had officially replied to the senator who issued the report, and signaled they will look favorably to some of the recommendations, mainly the human government. They will look favorably, and some noise about data and direction and control. So those are three key areas. If the government did it through a consultation and through engagement to the sector, can really change the playing field in the near future. And that maybe brings more voice for the sector in the policies. It's important to know too, and there's the other point about philanthropy and the reliance on philanthropy. The president of Ford Foundation, I guess he said, accurately said, that the charity can improve the symptoms of inequality. It can improve things, but it can never address the root causes. And what we need as a sector is a strong voice to really address the root causes of all these issues we saw. And we need a new deal from the government that's beyond handouts from grants, beyond handouts from philanthropic institutions, more of a system that has access to funds in an equitable way that addresses the real systemic issues and how to address them. And so we need a new deal, a new funding model where we move beyond donations and beyond the grants to something more sustainable, more predictable. And so we can address the inequities within the sector in terms of the pay wages, in terms of investment in new infrastructure, which is COVID might bear that the digital investment, that the sector is so much behind businesses. And so our mode of delivery of services will have to change with the technological advances that are around us. Currently, maybe our sector will not afford much of these investments, and so access to some sort of predictable, stable funding that can take many forms is really critical. Mm-hmm. And having whom in the government would facilitate some of these ideas, some of those concepts, and bring them into policies and into programs. And so I see a great hope, but I don't think the sector, as a sector, ready to exert the pressure in the political system to allow for a greater buy from the resources that the government is putting for the recovery. So there's hope, there are opportunities, but I think we have to move fast and we have to act as a sector, and we have to find the energy within ourselves and within our networks to really amplify those messages and help those who try to make our voice heard in important tables.
So on that note, on the hope and the opportunity, it sounded like CCVO and Alexa, you're explaining a big swing that you're taking in centering community as a central part of recovery and what that looks like. But I want to focus this question to Gemma, because we have 70 some people here that are members of ECVO and staff and board members. Like, what do we do here? And I want to kind of, I guess combine our last two questions, because I do want to get to some of the questions that are in the chat as well. But, what's needed from us as a sector? So what role do ECVO and us as a sector play? And then what can individual organizations that are on this call, what can we start to do? And this will be a question for all of you, but I want to start with Gemma on this, because I know, and it's sorry to start you or end with an impossible question, but what do you think? Like, what are some steps in the right direction here?
Yeah, so I think the organizations like ECVO, CCVO, Imagine Canada, Voluntary Alberta are really essential in this conversation, because we are organizations that are funded to work on behalf of the sector. So we're not funded to provide direct service delivery. We're not the people who are sort of providing those essential services to our most vulnerable Edmontonians, Albertans, Canadians. So I think that's the first thing, is that organizations like ours have a really important role to play. And then as members of these organizations, you have a really important role to play in terms of speaking to us about what are the most pressing social issues for the sector. Like, how do we want the sector to respond? Like, how do we want our advocacy efforts to go? Like, so I think that there's an opportunity here to think about organizations and CCVO is doing some amazing work in terms of this big hit that they're taking, and really focusing in on sort of the impact that they can have at that provincial level. I mean, locally, it's not the same in terms of the kind of swings that you can take, although we collectively as a community came together around the CIOG grant. So the Community Investment Operating Grant, which was 3.2 million, that had been slated by the municipal government to get rid of on the basis of a report to the city auditor, and that it wasn't getting outcomes that they would expect. And so we were able to really organise around that and bring the sector together to speak to council, to send, create letter campaigns. And now, currently the programme is under review. It was reinstated for the year of 2020. So I think that what that shows is the power of a collective sector. So when we come together and we put our voices together, we can really impact change. And so, and organisations like ours and networks like the ABNN are really well poised to take up that position on behalf of the sector. But right. What we need from our sector partners is we need your voices.
Yeah. Alexa, being, like I said, the equivalent organization in Calgary and working on some of these broader kind of policy pieces, what do you see as kind of the response, and how are we going to mobilize here?
Ditto to everything Gemma just said. And then I would just say, so with our ask with the Social Infrastructure Fund, we are CCVO, is going to launch an advocacy campaign, and we will be creating space, hopefully, for organizations to join that campaign and share with us that unified voice for advocacy. And so there's definitely an opportunity, hopefully, for organizations to join that campaign, and to make those advocacy requests to the provincial government, and to also, hopefully, we'll be able to create some space where organizations can talk about their advocacy priorities, and maybe we can find ways to move those forward together. And there are resources. So nonprofits sometimes get a little reluctant to be loud about themselves and about the issues. We have some resources on our website for everyday advocacy. There's an everyday advocacy guide if organizations just want some where to start. But telling the stories of what the contributions have been of nonprofits is hugely important. And I know we get reluctant to do that, but it is really important for others to know what we're contributing. And we just really want to be able to lead the way on making communities central to recovery. The last point, I think, just really quickly, I do think there is an opportunity for nonprofits in the vaccine rollout. So we actually have seen some of those inequities that we talked about at the start of this conversation play out in terms of our vaccine rollout. So Alberta's strategy was largely driven by age. There were some considerations for people with underlying health issues early on in the vaccine rollout, and some frontline healthcare workers, but until late in the rollout, for example, teachers weren't included, and then it was just a couple of days later that it was open to the general public. And so there was a recent report from AHS, Alberta Health Services data, that showed that neighborhoods with higher people living in lower income had lower uptake of vaccines, and populations that were higher with racialized people as well. And so there's some systemic barriers there. That's not vaccine hesitancy necessarily. That's there was a high degree of technology literacy necessary to book an appointment. There's time factors, there's just convenience and perhaps some language barriers as well. And I think there's an opportunity for nonprofits, particularly ones that are rooted in community, to be supportive in terms of that vaccine rollout and making it a more equitable distribution for people who are having a tougher time accessing that.
Right. As an example of the really important role we play in that connection to community for healthcare, for economics, and all the rest, right? Like it's that no longer a sideline piece here. We know that we've always known it's a central part of the way society functions, right? Abdul, just really quickly, and then I want to turn over to questions from the group because I know we have a lot here. So just a final couple sentences for us.
Yeah. Just one is that speaking about vaccines, as we speak, we are meeting with our chapter in Edmonton, as meeting with the province for a vaccine hub in our center. So hopefully that will materialize. We did one in Mississauga that was very successful. So I really agree that we are a community sector that really entrenched in communities, and this is where we can get our added value to society in one specific way. Just want to quickly, I think all of us have a role to play. All of us have to be advocates for the sector and for what we need. Just want to run one statistic. It's not very pretty, but I wanna say it. In the peak of the pandemic and the peak of the advocacy of Imagine Canada, Imagine Canada had about 1,000 organizations supporting its drive and its campaign out of 170,000 organizations. That level of activism and advocacy is so low that our voice will be drowned by even a group of any group that making any noise. Like, we'll not even capture any politician's attention or any policymaker attention if that is the level of advocacy that we do. So I think as an organizations, if I leave any point in this table, that every voice is important and every voice needs to be heard, and we are the collective voice of the sector. Nobody's gonna do it on our behalf if we collectively cannot do it. And I really think that 1,000 we need to push to the 50,000, 60,000 organizations that really put the resources to amplify amplify the message. And I think that advocacy and that participation, if we don't do it, we only have ourselves to blame. Just want to end with one, I guess, maybe catchy phrase, but I think it's important for our sector to lead the recovery and the rebuild with it. Is that there's a proverb in New Zealand, is that we walk to the future walking backward, meaning that we need to look at why we are where we are, and as we walk into the future, we shouldn't forget the causes and the reasons that get us where we are. And if we let politicians do it their own ways, they're gonna do it what they know best. So I think our voice is important, and that community voice and those values that we espouse must be part of that walking back into the future, and so that all these inequalities that were done and committed in the past 50, 100 years, we need to address in a major fundamental way. And I think our sector has a voice to add, and will contribute to that realignment of values.
Mm-hmm. Well put. So I'm going to turn to questions. Lisa, is there any kind of like theming here that you could do for, because we got a lot? So.
There's not so much theming, but I can summarize them and I'll throw them back to you and you can decide who you want to direct them to. And I'm just going to go in order. So there was a lot of talk earlier on about the impacts on racialized women. So we had a specific question about what exactly is the sector doing to support immigrant women at this moment in time.
Yeah, I guess Gemma, Alexa, I'd look to for maybe an Alberta response. What does that look like here right now?
I would say that locally there's organisations like MFRS that are doing some distinct programming for racialised women in leadership. But when we think about a broader policy directive or a broader sort of directive coming from a municipal government, we're not seeing anything right now. Although the Minister for Social Services has really, at provincial level, has identified strong women, strong communities as a priority. So as we think about strong women and racialised women as part of that strong women piece, I think there's an opportunity in front of us to really think of it as a sector, like what does strong women mean to us, and how do we support racialised women in this space?
Mm-hmm. Alexa, how about you from your perspective? I know you talked a lot about the gender imbalances when you were first speaking.
Yeah, so as Gemma said, that message has clearly resonated to some degree with the Minister of Community and Social Services, who's, I think, seems aware of that issue. There are some organizations locally in Calgary, CIWA, the Calgary Immigrant Women's Association, Center for Newcomers, and Action Dignity in particular. They were quite vocal around the Cargill outbreak and the impact that had on communities as well. So those are a few organizations to pay attention to.
Thank you. Lisa, I know we're kind of running out of time here. I believe we want to end, Gemma, we want to end right at noon. Is this correct? Or... Yeah,
and I do have like a couple of things I just want to end.
Oh God. Okay. Sorry.
I need 30 seconds.
All right.
One more question?
Yeah, let's one, maybe two, if we can be really succinct.
Okay, so somebody asked, can you speak to the future of social finance, social innovation, and social enterprise in the nonprofit sector, and how that would potentially intersect with the corporate and public sectors?
Abdul,
I think
know you spoke about this.
Yeah, I think great question. I think it will take more than an hour to explain, but it is one of the tools we want to add to this new funding model, where social finance and the social enterprise and innovation become part of the tools that the sector has. But there has to be some fundamental changes to the governance of the whole sector. But that's really one of the tools that will allow us access to funding and give us more leverage in generating our own as well. So it's one of the tools, one of the big tools for future self-sufficiency in the sector.
not to stick my nose in here, having been part of this conversation too, I think it is, akin to all the other conversations we're having for us to get educated and have a voice in that discussion. Otherwise, it's going to be, I think a lot of the social finance discussions and social enterprise discussions and those types of things are going to be, frankly, held without you. So I think it's about getting educated, understanding who's doing the work in that area, and making your voice heard to make sure that those mechanisms work for community. Sorry, as the moderator, I have to jump in at least once. Lisa, one more question, and then we'll turn it back over to Gemma.
Yeah, so I'm going to bring it back to an Alberta level. So this will probably be to Gemma and Alexa, but there was a question about the role of the Premier's Council on charities and civil society in regards to how it can act as a mechanism in championing everything that's been said today. And then there's sort of a second part of that around recognizing that their focus is explicitly on women at this point, what that means and how that will impact potentially other groups in moving some of this work forward.
So I can have a go at that first. I think that's a really complex question. And ABNN did meet with the Premier's Council this week, and John Lilly was on the call earlier. I'm not sure if he's still on the call right now. However, I think that what they've been doing, the council was convened right as COVID hit. And so they were given their mandate, but yet they were responding to some of the issues that had been highlighted because of COVID. And they're now just getting into a space where they're doing a strategic planning. So I wouldn't say that they're focused solely on women at all. I think that that's the directive from the minister, strong women, strong communities, and they'll be looking at how they can intersect into that space. But they are doing strategic planning. They've got some strategic priorities that they've got sort of lined up. And I don't think that I'm going outside of my authority to say one of the things that they really do want to do is engage. They want to engage with community. They want to engage with formal and informal community groups. They want to really understand how they can play this role within community. So I would say that the onus is back on us to facilitate those mechanisms to support the Premier's Council to be able to connect in, and you can have your voices heard around those tables, because I think that without your voice, they don't know what the needs are. They're not as tied to sort of all of the groups. They're tied to sort of the work that they do. I don't know, so do you have anything to add to that?
So just recognizing we're at noon now. And so this was really amazing. Obviously, we were trying to tackle hugely complex things that we could probably talk about for, I don't know, weeks on end, and do talk about for weeks on end. And we also, I want to recognize that we have a lot of expertise in the room. And so I thought the conversation in the chat was really good. I highly recommend to scroll through that. Thank you to Gemma, Alexa, and Abdul. This was really incredible. Such great perspectives from across the country, both provincially, and you brought, I think, a really good holistic view of what's going on, and I think left us with a pretty clear message that there's an opportunity here to figure this out collectively and start to move. And I think there are mechanisms already in the works that we can work with and utilize, and new things that need to come on board. So thank you guys so much. Please, I know we're not in a room together, but really great, big round of applause. Over to Gemma, because I took us too late as a bad moderator.
No, that's great. So I have to pose a question to you guys, and we're going to put a link to a small survey in the chat, and we will also be emailing it out. But we're doing quite a bit of work in the run-up to the municipal election, and so we'd like to pose the question to those on the call, and as I say, we'll be following up, is what priorities should our municipal leaders focus on as they consider an equitable recovery for the non-profit sector and the communities they serve? This is really important information for us as we start to really ramp up our work in this area. So I think that the link should have been shared within the chat there. Please go ahead, fill that in. And as I said, we will be emailing it out immediately following this. And the other thing that I just wanted to let everybody know is that June 11, we're going to be doing a lunchtime meeting from 11:30 to 1 with Senator Omdeval. So she's going to join us for a discussion on why our board should represent the communities we serve, and how Bill C-222 aims to strengthen the charitable sector. So this is really connected to the work that we've been doing. It's connected to the report that we're going to be releasing on Monday, which is really focused on transformation in the nonprofit and charitable sector in Edmonton. So I encourage you all to dig into that report. It is big, but it's great. It's good reading, I promise you. As soon as we've got the registration up, we'll be getting that sent out. But June 11 holds the date to join Senator Omdevar on what's going to be an amazing conversation. And I just want to thank all of our members for joining us today, our panelists, my board members. Without you guys, we wouldn't be anything. So I think that just thank you all for joining us.